Hello, I'm Dr. Bang Ji-sung, the hair wizard who protects your hair. It's a pleasure to meet you. Hair loss medication is effective. It really is. There are individual differences, and because some people occasionally experience dramatically good results, I'm reluctant to give up on this. Consider two scenarios. One person undergoes a single effective surgery and consistently uses drug treatment for a decade, while another forgoes medication, opting instead for 2 or 3 well-timed surgeries. After 10 years, which individual do you believe would present the more natural appearance? You have to think about this. I used to think, medication is unsettling, it might have side effects, and it just feels iffy. Isn't it better to just get surgery if you can? I once thought that, but I was wrong. Among my patients, there are those who've undergone 3 or 4 surgeries without medication, and their hair density has suffered noticeably. Ultimately, they ended up regretting not having taken the medication. With surgery alone, you simply can't expect the sustained maintenance effects that drug treatment provides. To be frank, if you have a family history and a rapid rate of hair loss, but didn't take medication, then, at least 5 to 10 years from now, you'll need surgery plus something additional. That something additional might very well be drug treatment at that point. I do a lot of consultations for revision surgery, and more than half the patients who come from other clinics haven't been taking medication. With these patients, I have them take medication for a year along with surgery. Then shouldn't only the surgical area improve, but the non-surgical areas improve too. Improvement in non-surgical areas means there's a change in the body, and it's a positive one. Why does this happen? Is it just from hydrating, exercising, stressing less, and generally taking care of my body? Drug treatment also proves effective. For this reason, I tend to recommend drug treatment. Even after explaining this, some still refuse. In those cases, I use another method. I'll explain that to you later. Understood? That particular method is quite effective, but its duration is a bit shorter. But regardless, the medication is effective, and starting drug treatment is truly beneficial. That's what I want to convey. The mechanism of hair loss medication, as I explained, is to ensure that the hormone DHT is produced in smaller quantities, so it won't trouble you, right? Let me put it this way. Imagine there's someone in your neighborhood who bullies you. They used to come and hit you every day, but then that person got caught. So, they can no longer bother me. Now, if I possess a strong recovery ability, the areas that were painful or struggling will indeed heal. However, if I lack that capacity for recovery, I'll be forced to live with those impairments, won't I? It depends on how much the hair follicle was damaged and how strong it was to begin with. So, there are huge individual differences. Some patients truly seem to grow hair right after taking the medicine. Regardless of age, it seems heredity plays a role. It's really gratifying to see those patients, but for others, there's absolutely no change. Honestly, some even feel like their vellus hair is shedding more or wonder if anything is changing at all. Just taking medication by itself won't necessarily fill in those empty spaces. But sometimes it does happen for some people. It's not a doctored photo or a lie, they really exist. No one knows if you'll be one of them or not. That's what makes the medication worth trying. It's not a gamble. Taking the medication will definitely maintain or improve your condition. And while it might not grow new hair, I want to emphasize that some people recover so well it looks like new hair growth. Today, I've briefly discussed the significant efficacy and true value of drug treatment. It's a good medication, that's what I want to say. And if you try it even for a short time and see results, I think it will be helpful. Thank you.